Welcome to a brand new episode of Thunderspot. Within a span of few days the whole world started to shiver. Many developed countries were locked down. Demand of goods increased. Stock market went in bloodbath. Sports teams are playing in empty stadiums, or not playing at all. Cancelling huge gatherings and festivals. Temporarily closing schools and offices. Telling people to avoid personal contact. People are severely suffering, and everything started due to the rise of coronavirus. In this video, I will be explaining everything related to coronavirus, and you make sure to watch till end, to know how much dangerous it is even to you. Before getting started, make sure to subscribe, and hit on the bell icon, so that you will be notified whenever we upload a new video. Now let's dive into the topic. Number 1. What is coronavirus? COVID-19. Coronaviruses are a large group of viruses that are known to infect both humans and animals, and in humans, cause respiratory illness that range from common colds to much more serious infections. The COVID-19 virus is a member of the coronavirus family that made the jump from animals to humans late last year. In December 2019, a novel coronavirus, COVID-19, was detected in 3 patients with pneumonia, connected to the cluster of acute respiratory illness cases from Wuhan, China. By the end of February 2020, several countries were experiencing sustained local transmission, including in Europe. Unusually for a virus that has made the jump from one species to another, it appears to transmit effectively in humans. Current estimates show that without strong containment measures, the average person who catches COVID-19 will pass it on to others. The virus also appears to have a higher mortality rate than common illnesses such as seasonal flu. Though the mortality rate is approximately 1%, yet as compared to the number of people affecting, mortality rate is significantly more than other viruses. Coronavirus slowly starts as a normal cold, cough, and after few days it will affect mainly to the respiratory system and eventually it will lead to death. Coronavirus is a new strain that was discovered in 2019 and has not been previously identified in humans, and there is no medicine at this moment to cure the affected ones. Coronaviruses are actually zoonotic, which means they are transmitted between animals and people. Detailed investigations found that SARS-CoV was transmitted from civet cats to humans, and MERS-CoV from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Number 2. How did it all started? It was at the time of New Year. People in China were preparing for the celebrations. The disease appears to have originated from a Wuhan seafood market in China, where wild animals including marmots, birds, rabbits, bats, and snakes are traded illegally. Coronaviruses are known to jump from animals to humans, so it's thought that the first people infected with the disease, a group primarily made up of stallholders from the seafood market, contracted it from contact with animals. Although an initial analysis of the virus that causes COVID-19 suggested it was similar to viruses seen in snakes, the hunt for the animal source of COVID-19 is still on. Wuhan Institute for Virology released a detailed paper showing that the new coronavirus's genetic makeup is 96% identical to that of a coronavirus found in bats. Some early cases of COVID-19, however, appear to have inflicted people with no link to the Wuhan market at all, suggesting that the initial route of human infection may predate the market cases. The Wuhan market was shut down for inspection and cleaning on January 1st, but by then it appears that COVID-19 was already starting to spread beyond the market itself. There is no clear statement which supports the actual cause of this outbreak, yet majority of the data is pointing towards Wuhan's market. Number 3. The outbreak. China has borne the brunt of COVID-19 infections so far. As of March 11th, Chinese health authorities had acknowledged over 81,077 cases and 3,218 deaths. On March 16th, China recorded just 29 new cases of the virus, a remarkable slowdown for a country which, at the peak of its outbreak in mid-February, saw more than 5,000 cases in a single day. But while things were slowing down in China, the outbreak started picking up in the rest of the world. There are now confirmed cases in at least 150 countries and territories. Outside of China, Italy has seen the highest number of cases, with 27,980 confirmed infections, mostly in the north of the country. The entire country is now on lockdown. While the number of new cases continues to rise sharply, people are also recovering from the infection. Globally, 80,643 people have recovered from COVID-19, about 42% of all of the people who had confirmed infections. I will drop the link of this site in the description below. Number 4. How is it spreading? If you know about compound effect, then that's what's happening here. On day 1, no one you know is sick. It feels like a normal day. It may stay like this for a long time, until one day, a few people you know are sick. And suddenly a few days later, it will seem like everyone is sick, and it will feel like it happened instantly. Everything looks fine, until it isn't fine. The maximum time to know that you are infected with coronavirus is 15 days. Which means until 15 days you will not know that you are already affected with coronavirus. And the actual problem lies here. Until this course of time you are the host of that virus and you will be spreading it to every single one you spend time with. Now, let's understand this graph. If a person has confirmed that he or she has coronavirus, then next day the number of cases are increased drastically, because in those time gap of 15 days people are infected by him, and parallelly other peoples also get infected, and eventually they also spread them. The line represents here is the hospital services, beds and the limit of treatment it can provide. If there is an exponential growth of infected people, then there are more chances of deaths. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. It's a chain reaction. Even a developed country like Italy is now locked down. Then, what about developing and underdeveloped countries? It is much more dangerous than we think. The only reason why COVID-19 is spreading is only due to negligence. Number 5. Other effects of coronavirus. Due to coronavirus outbreak, most of the business went into loss, because most of today's world is directly or indirectly dependent on China. Even though now China's conditions came to normal, but the whole world is suffering now. Transport of goods has been stopped. Stock market is going down as most of the shareholders are selling their stocks due to the fear of coronavirus. Dropshippers and other small business stop their sales. This is unfolding to the world economic crisis. Even if you are not affected with coronavirus, you will surely get affected with economic crisis. So, what I would suggest you is to get the needed supplies and food, and make sure to have liquid cash. Preventions. Prevention is always better than cure. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. New reports have shown a clear data of people who are mostly affected by coronavirus are the people with blood group A, and the most immune ones are with blood group O. As I was researching about prevention methods, I found the most fundamental and basic thing: improving our immune system. This is only the last line of defense we can do, in addition with all the others we just discussed. Surprisingly, no one is speaking about that except one guy. He was Eric Edmonds. I will drop his video link in the description below. Make sure to have a look. There are many conspiracies about the origin of COVID-19, as an bioexperiment, or a political war between US and China. Nothing is clear at this moment, yet our focus should be on prevention. Last but not least, stay at home, and please avoid social gatherings.